Good afternoon, Valley Youth House team. If we haven't met, I'm Tom Harrington. I'm the CEO for Valley Youth House, and just wanted to take a few minutes this afternoon during this pretty crazy week to just visit with you briefly about what Valley Youth House is doing related to this coronavirus situation that we're faced. First of all, I understand that many of you may feel stressed. I feel stressed. It's been a crazy week. And want to take a minute to let you know what we're doing to respond to this. First of all, I want to let you know that our overall focus during this time is twofold. First, it's to ensure the health and safety of our staff members is of utmost importance. But second, tied in there is the health, safety, and care of the young people and the families that we work with. As you know, many of the youth and families that we work with have experienced trauma in their life. And during times of uncertainty like right now, they may have heightened anxiety themselves and fears, and they may do things like isolate themselves and resort to behaviors that maybe aren't helpful. And they need us now more than ever to be there for them. For many of our clients that we work with, you're the only caring, stable person in their life. So as a result of that, I want to let you know that during this situation, this coronavirus epidemic, Valley Youth House is not shutting down. We're going to continue to provide our services to young people and families. But we're going to make some modifications to make sure that you and others are safe during this time. So first of all, if you're sick, stay home. Don't come to work. And in the past, where we required a doctor's note if you were out for more than 3 days, we're not going to require that now because the doctor's offices might be overwhelmed anyhow. Second, if you can telecommute, please do that. If you can work from home, bring a laptop home, or you have a computer there, or your cell phone, work from home by all means, doing your paperwork and whatever you can do from home, do it there. We ask that you avoid large group meetings. And we're saying the number right now is 50 people. If you're expected to go to a course or a session that you think is going to have more than 50 people, please don't go. It'll probably be canceled anyhow. And if you are in a training session, practice what's called social distancing, which we're all learning what that word means now. Because of the situation right now, and many of our employees may not have enough banked sick days, we're providing 10 additional paid sick days for every employee if you need it. So if you are confirmed with the coronavirus, or if you are quarantined because you have been exposed to the coronavirus, your first 10 days, 10 working days, will be additional sick days that won't be charged to your sick day account. In the email we sent out yesterday, there were lots of information in there. There's information about how you self-report to get those 10 paid sick days. Now, I know that in a number of our communities, schools are closing down or are already closed. And I would anticipate there's probably going to be more school closings in the future. Sorry, there's my phone. Shawnee Meacham is calling me. I'll have to call you back, Shawnee. More schools are probably going to close in the future, and we're going to meet on Monday as a leadership team to talk about how do we handle this, because a lot of folks are going to be tied up trying to figure out how to take care of their kids. So look for some more information there. And related to that, if we have some people that go out sick at some of our residential sites or our shelters, we're going to be calling on additional staff members to fill in as relief staff. So we hope that if you're able to and you're looking for some extra hours, that you'll be able to volunteer for that. And for anybody here, if a staff member or a client tests positive for the coronavirus, you have to let your supervisor know. Eventually it has to come to me because we have to report that to the state of Pennsylvania. So those are some of the things that we are doing to respond to this. And I want to let you know, I want to close by letting you know that, first of all, things are going to get better. This is temporary. We at Valley Youth House will continue to serve youth and families. We're going to have to get creative in how we do it, but we're going to figure out ways to continue to serve them. And we have to strike a balance between taking care of our own health and safety and taking care of the health, safety, and care of the people that we are charged to work with. And I would encourage you to take time for your own self-care. So turn off the TV for a while. You can only take so much of that. Get outdoors. It's going to be a beautiful weekend. Get outside and walk. Do whatever you need to do. Work out, read, get plenty of rest, eat well, all those things for self-care. It's very important. And I want to reassure you about a couple things. First, we are in good shape financially as an agency. We have the funding available to weather this storm. We have several outside experts who are helping advise us on how to respond to this, including the Director of Infectious Diseases at Merck and the Director of Infectious Diseases at Doylestown Hospital. We're going to keep monitoring this situation closely and making changes as we need to, and we'll communicate that to you. Our commitment is to your health and safety and to the care and support of the youth and families that we work with. So on behalf of them, I want to say thank you for your help, and let's keep in touch. If you have questions, which I'm sure there's going to be more questions that will come forward, please feel free to email my assistant, Ashley Selmaska, and we'll compile all those questions through her. And you can get her email address by just typing in ASEL, and the rest of her name will pop up, and we'll be able to get kind of collate all those questions and get back to you. So thank you again for what you do every day, and stay healthy.